Welcome back here today on the beautiful campus of Florida Panhandle Technical College. Summer is here. I think that when I first moved here to the state of Florida about 45 years ago, somebody said there are three seasons: too hot, too cold, and too nice to work. We're through with the too nice to work season, I'm afraid, and now it's just plain too hot. It's only May, and it already feels like July or August, but still the hottest part of summer to come. Watermelon Festival, Possum Festival, certainly the 4th of July. Lots to enjoy right here in what we call the real Florida. Our guests today are Shawna Nelson and Jennifer Hall from Northwest Florida Community Hospital. They work in Senior Enrichment. If you're a regular viewer of the show, you've seen Shawna and Jennifer before. When they appeared on the show the first time, they had just started the program. They're here with good news. The program has taken off and they're doing well. They've got patients on board. When we come back, we're going to talk to Jennifer and Shawna about what is Senior Enrichment, what is it that they do. We talk a little bit holistically about Northwest Florida Community Hospital. All just a great part of this community that we call the real Florida. We'll be right back. Welcome back. As mentioned, our guests today are Shawna Nelson and Jennifer Hall from Northwest Florida Community Hospital in Senior Enrichment. Senior Enrichment, we talked about it. We spent a whole show, 5-6 months ago you guys were here?
It's been some time. Mm-hmm.
Thanks for coming back.
I appreciate it.
Yeah, I saw you at Relay for Life, and I saw Jennifer at the Council on Aging in Holmes County just a week ago. Yes. And and mentioned to both of you that about time to get you back in our Kiwanis Club program, and also on the show. You said you had good news and bad news. The bad news is that you couldn't come to Kiwanis, and the good news part of it was that because you were busy and you were bringing on patients. Let's start at the beginning. Shawna, tell me a little bit in a nutshell, what is Senior Enrichment?
I really think the easiest way for me to explain it is that we all kind of hit a bump in the road sometimes, and our job, our goal is to help people get over that bump in the road. And what we do is we get together with a group of other seniors, and everybody talks with Jennifer and with myself, and we really work through these issues and really work on how to cope better so that we can find hope and live the life that we deserve to live. And we do education. It's just a really good time for, for people to gather together and really find common ground so that they can move on.
Jennifer, nobody wants to admit, number one, that they're a senior, probably, that they're getting on up there in age. Number two, that they may need somebody else in their life. So many people are islands, they're a rock. They don't want to admit the fact that they've got emotions or feelings, or that they just might be a little bit off and just need somebody else's help. I would imagine that's probably one of the single biggest impediments to you getting people to acquiesce, to come in, to talk to you, and to ultimately take advantage of the services that you offer. How do you go about expressing to that senior community just exactly what Shawna was talking about, explaining to them that there's no stigma attached, that you guys are there to help? How does that process work?
Well, one of the first things that I'm going to tell a referral or someone coming off the street is this is a judgment-free zone. What you tell us is your business. It's yours to keep and share as you will, and we value and honor anything you choose to share with us. However, one of the things that people do tend to have a problem with is admitting we need help. And I say we because we all do at some point need some help. So one of those issues is maybe they've always been the father, always been the mother, always been the caregiver, always been the provider. So one way to understand that better is to say that you can do all those jobs better with a little assistance. We can all make improvements in our life, and most people can relate to that and appreciate that, and that makes us more comfortable in reaching out for help. If I can do better at what I'm supposed to be doing, I can reach a little further for a little more help.
By default, and the name of the program is Senior Enrichment, you work with seniors. What do you as a group consider a person, at what age or at what time in their life do you consider them to be a senior?
Typically our patients are 65 and above. However, the ages do range. We've had so far anywhere from the high 50s to even in their 90s come to us and seek assistance. So it really is a wide range.
Yeah. Well, that says a lot for the community if you've got 90-year-old people coming in to see you guys at the hospital. I mean, that's good. Both of my parents are 90. My mother still cuts her own grass with a push mower, so that makes me feel good. You know, my dad's not in such great shape, but he's got more hair than I do, so, you know, I'd like to think that
There's
maybe
always
that bodes well. Yeah, yeah, absolutely. It's funny because when guys are bald and they have friends with hair, the guys with hair say, oh man, you look great that way, you know, you shouldn't be so self-conscious about it. But if you have hair and you start losing it, you know, you start getting that little bit of...
rough stuff from my understanding.
Yeah, I don't know yet, thankfully, but, you know, you'd like to think that you can put up with it. The way that segues into what we're talking about is that fact that it's easy to look at somebody else and say, you know, if they would just go and talk to somebody. But again, as Jennifer said, so often it's not us that has the problem, it's not us that needs the help, and by God, I'm not going to go admit to anybody that I need that help. How did the Senior Enrichment program get started, Jennifer?
Well, initially there was another similar program, and it actually started in Graceville many years ago and moved to the Chipley Hospital, where it was very successful for a long time. Last year, they closed that particular program and reopened this program.
Okay. So it was a heritage program. Now, was there a period of time that you say that you went without that program, that was not available?
There were several months.
Okay. So not that long.
No.
Did you end up inheriting patients from the former program, or did you have to start with a clean slate?
Both. We have some patients that are from the previous program, and the reasoning was, you know, they did see such a great benefit for what the program did for them. And so they sought us out again, and knowing that it was a very similar program, they wanted to be able to use us as a resource to better themselves once again. So some of ours are from the previous program, or have been rather from the previous program, and then many of them are brand new to us and to the program itself.
Somebody comes in, they find out about your program, they take that big step and say, you know, I want to at least talk to these people. Maybe there's something that I can use from this program. They have a meeting with you, you counsel. What, going forward from there, would what kind of elements would be put into play that they would then take advantage of to try to seek some kind of solution to whatever it is that they're facing?
Right. Well, most of the time, a referral or a self-referral will come in and visit with us, and we'll do what's called a determination of treatment. And it's kind of a biopsychosocial kind of questionnaire with some anxiety and depression screening. And based on those, I can pretty much tell if someone would be eligible for the program. I can also answer questions if they, don't want our program, but might want some other kinds of help, and refer them out from there. And that's something that Shawna and I do together, look at what's available in the community and what might be helpful for this person if either their insurance is not appropriate, or they simply aren't as interested as they thought they might be, or whatever the case is. And we get a really good snapshot of the individual at that time. If they're appropriate and they wish to return, at that time we schedule them a psych evaluation with our practitioner, and we do an admission. Now, remembering our program is voluntary, and admission means admission to the program. We're not in any way admitting someone inpatient. It's a day treatment type thing.
Yeah, so, and two things open up with that answer. Number one is the self-referral. So you don't have to go to a psychologist or a psychiatrist or to even an MD and have them say, hey, listen, you need to seek attention. Somebody hearing this program could actually say, you know, that sounds like something that I would like to find out more about. That self-referral thing is huge.
Yes.
Because so often with insurance and pre-existing conditions, people are afraid to go to a doctor, go on record as having an issue of some kind, whether it's medical or psychological, because they either won't be covered with future insurance or they just simply don't want to admit, as we started off by talking. The second part of that is the going on for further help. When you say one of our treatment specialists or the next step, who would those people be? Would those be MDs or psychologists, or who would they see after they go through the screening with you guys?
Well, when they're admitted, they would see the practitioner or the psychiatrist.
And a practitioner would be who? What kind of bona fide would they have? Would they be like a nurse practitioner?
Yes.
Yes.
Okay.
A psychiatric nurse practitioner.
Okay.
And then beyond that, they would see me on a daily basis to receive mental health therapy.
So potentially getting a prescription at this time too, after having gone through all that screening, antidepressants or whatever, that's a possibility as well?
We can work with medication through our practitioner for our patients, or we can work with their doctor as well to help them with that if they want their primary care physician involved.
And everybody's different. Some people come in and say, I absolutely am open to these different types of treatment, be it medication or otherwise. And then some say medication's not an option. And they would rather focus more on non-pharmacological ways of treatment. Either is fine. And we also do take into consideration, because some people are very adamant, and that is absolutely appropriate for them to want to go through their primary and make sure that they also have a say in that as well.
So there can be a self-referral, there can be a referral from a practitioner or MD.
That's right.
Is there a possibility that there could be somebody that would be court mandated? Would there be like a Baker Acted person or somebody who has gone through that part of the legal process and they referred to you for follow-up or for some kind of diagnosis?
That is a possibility. Typically, when someone is Baker Acted and then they receive inpatient treatment, part of their discharge planning process is for them to also seek an intensive outpatient program, which is what we are. That's what it's considered. So if someone, say, is Baker Acted and receives inpatient treatment, and maybe they live close to our area, and it would be easier for them to come to our program rather than travel to maybe Panama City or such, they could absolutely become part of the program.
And then the other thing that you mentioned earlier was insurance. Does most insurance cover your services?
We bill through Medicare Part B. So typically patients have Medicare with a secondary. And so far everyone who has had the straight Medicare with a secondary, it has been covered in full. And we are also working to receive a wider range of coverage with other Medicare, PPO, and HMO plans.
And obviously, again, by default, you work with mostly seniors who typically would be covered by Medicare, and then whatever the other supplement that they would have. What's been the biggest challenge? You know, you came on 5-6 months ago. You said this is a brand new start to an older program. What is your biggest challenge today? It sounds like you're getting busy, and maybe the biggest challenge is trying to keep up with what's going on.
I'd say one of our biggest challenges has been insurance, that's something that we are working through, and our hospital staff has been so great at helping us do that. And so we're working through that because so many people have switched over to the HMO and PPO plans, and so that is a little different. I'd say another one has probably been a stigma, and that is something that we are really working through with people and helping them realize that there shouldn't be a stigma attached. If your heart can get sick and if your lungs can get sick, it only makes sense that your mind can as well. And that can mean many things for many people. But I really think the stigma is one thing that we've worked through, and we've seen a lot of change in that already.
Well, you know, unless these people are going to go out on the street and tell people their business, what's the stigma? Obviously, you're charged with HIPAA standards and confidentiality. So, what would be that? They're just afraid of seeing them walking out of the hospital or from your office or something, or?
I really think for them, it's just
probably in themselves.
Probably,
more than anything.
yes. That's what I'm thinking, is for themselves to really, like you guys had mentioned earlier, say that, you know what, I need that help, and we do. We like to be strong, independent people, and I feel like most of us are probably raised that way, to be strong and independent. And I think sometimes people see that seeking help means that there's a character flaw, that's a sign of weakness, and it is absolutely not. I think sometimes seeking help takes more strength than not.
With the patients that you're seeing now, and you say you have admissions on Tuesday, or you have some function on Tuesday that would preclude you from going to Kiwanis, do you typically find that these people are accompanied by family, loved ones, or are they more often than not coming in by themselves?
Normally they would come in by themselves. Sometimes a loved one will bring a patient. However, most of the time the patient wants that autonomy of being with us alone, and the family actually respects usually, and I don't want to use the word enjoys, but enjoys the fact that the patient can have that independence with us, and we'll take care of them, and they feel safe leaving their loved one with us till they return.
Now, enjoy would be a perfect use of the word. To me, I would want to know where I had to drop my parent or other loved one there, that they were in good hands, and that it was a certified, bona fide, accredited program. What does it take to do just that? What does it take for Northwest Florida Community Hospital to have that service? Is there special training? Is there some kind of a accreditation that you need to do that senior enrichment part of or service?
I think the biggest thing is probably making sure you have the right professionals to do it. We, of course, are part of the hospital. We are not separate from the hospital, so we go through the same accreditations and everything that they do. But making sure that you have the staff, you have to have an RN present, you have to have the psychiatrist present, you have to have your therapist present. So making sure that you have those individuals to take care of the patients as they deserve, I think is probably the biggest.
Okay. Jennifer, you are a therapist?
I'm a licensed clinical social worker, which is a master's degree program followed by 2 years of postgraduate work as well, which would be similar to your licensed mental health counselor and other professions like that. Recently,
we did a segment on social workers, and most people, everybody knows the term, they've heard the words, but they don't really know what social workers do. Then there's many different varieties, obviously.
That's right.
Your specialty is targeted toward exactly what?
Clinical, so counseling, therapy, diagnosis, that sort of thing. Now I have a background in hospice, I have a background in domestic violence, I have a background in youth as well. But my specialty is clinical, which says I will work with patients on a one-on-one basis and be with them. So that is something that my education gives me as well as my experience.
Yeah, and it's interesting when we start talking about things that deal with the mental portion of a person. You can't do a blood test, you can't do a written test or even an oral, what has to be oral, but it takes somebody such as yourself with your training to spend that time with somebody and to kind of drill down a little bit to find out those underlying problems. So I can see where there would be a need for that specialty. When we come back, I'd like to talk a little bit about this, that you said this upcoming month is what?
This month. May is actually Mental Health Awareness Month.
Let's talk about that when we come back. Our guests today are Shawna Nelson and Jennifer Hall from Northwest Florida Community Hospital, talking about senior enrichment. Certainly a subject worth exploring a little bit. If you're getting on up there in age, perhaps, or even if you're not, if you're maybe a little depressed, if you're just a little off, probably a good first step, come in here and talk to these ladies and find out a little bit about what your options are, what services are available. Sometimes help is just that call away. We'll be right back.